Hey everybody, welcome to Best List. Today we are going to go over the top 10 unsolved mysteries of COVID-19 pandemic. Make sure to watch until number 1. The COVID-19 pandemic is changing the world in unexpected ways, and now close to 2 million people around the world have tested positive for the virus, with over 125,000 deaths. The human cost also includes the many millions around the world who will suffer in forthcoming financial recession. Number 10. Why are young, fit people dying too? One of the most concerning parts of the pandemic is the disproportionately high rate of fatalities among the elderly. This allows the virus to spread virtually undetected among youngers, less vulnerable parts of the population. You may think that's a good thing, but it's not. SARS-CoV-2 can lie undetected and spread far and wide until it reaches the older hosts and wreaks havoc on them. If the symptoms were a bit more severe and detectable in their early stage, the virus would have had a far harder time reaching its old targets. That doesn't mean that the younger people are immune, though quite a few of them have died from the virus too. It's something we don't yet completely comprehend, as according to our current understanding of the pandemic, relatively fit and younger folks should not be developing the more serious symptoms. It's a big part of a larger question of how the virus affects different people in so many different ways, and answering it is crucial to preventing future, potentially deadlier outbreaks. Number 9. Can we infect animals? Despite the rather long list of things we still don't know about the COVID-19 pandemic, we do know that it comes from animals. There is still fierce debate around exactly which animal it was, with pangolins, bats, and even poultry as potential suspects, though we are guessing researchers will get to the animals once they are done with the humans. What's baffling scientists, though, is how the mutated human form of the virus is now transmitting back to animals, something no one had predicted. Among wild animals, a tiger at Bronx Zoo was recently diagnosed with the COVID-19 strain, along with severe others starting to show similar symptoms. While it's hardly the only case of its kind, all of the other cases of human to animal transmission involves household pets. This is the first instance of the SARS-CoV-2 strain infecting wild animals, and no one is sure how. Our best guess is that it comes from one of the infected zoo workers without any symptoms. If that's the case, it should have passed on to other animals too. No other animal, not even the other big cats, have shown any symptoms yet, so it's possible that it just affects tiger for some reason. Number 8. We still don't understand its biology. It's true that COVID-19 outbreak has disproportionately affected the first world, meaning that some of the world's best healthcare experts are currently hard at work trying to understand how it works. Wrongingly, though, that hasn't meant much, as the SARS-CoV-2 strain has proven to be far more difficult to understand than we ever imagined. At the heart of the problem lies the big question about the fundamental biological structure of the virus. While we do know that it's shaped like a skippy ball with the spikes meant to break into living tissues, exactly how that translates into the unrealistically high rate of its spread remains a mystery, as many other relatively harmless viruses, including other coronavirus strains, have the capability to do that too. We simply don't know what it is about the SARS family of coronavirus that makes them so deadly to human, or even, as we will come to in a bit, how it learned to affect human at all. Number 7. Its evolution in humans is still poorly understood. The biology of the virus may help us better understand its effects, though there is still the questions of exactly how the SARS-CoV-2 strain learned to infect humans at all. While we are no stranger to coronavirus infecting people, they have always needed some time to mutate and learn to infect new hosts. The last SARS strain, also called SARS Classic, needs some time to mutate in the human body before causing any real damage. The current virus, however, seemingly knew how to infect and kill from the get-go, as it hasn't changed in any considerable way since the start of the pandemic. That doesn't mean that it isn't mutating, though none of the mutations have been able to gain dominance over the original one. Put it this way, the current SARS-CoV-2 strains doesn't need to change itself to infect more hosts, yet as it's already able to do that without much effort. Number 6. People are testing negative and then positive. While we are grapple with tens of thousands of cases showing up around the world every day, doctors are faced with a new unexplained problem. Many patients that were previously found to be negative are now testing positive, calling into question the very methods and tools we are using to detect it. While it's true that the virus can remain dormant for some time before it shows any symptoms, nearly every country is already taking that into account before discharging suspected patients. Guidelines from the now decreased and defunded WHO require that all recovered patients should test negative for the virus twice, with an interval of at least 24 hours between the tests. Concerning some of those recovered patients are now testing positive for the virus, and we have no idea why. According to some experts, the virus may have the ability to detect and reactive itself inside a human host, though it could also be patients getting reinfected from other source after being discharged or something else entirely. We just don't know all of those possibilities, though fly in the face of popular notion that the recovered patients would develop some kind of immunity towards the virus, as it works most other diseases we know of, which would in turn strengthen the collective immunity of the people whole population. Moreover, if the virus can just reactive itself on a whim, what does recovered even mean? 5. The carriers with no symptom at all. If you study the various pandemics in history, you will realize that the secret of the Chinese virus's success isn't its high rate of spread or even fatalities. We have dealt with far deadlier diseases than this one in the past. It's nowhere close to the Black Death or the Spanish flu in its death count or rate of infection. It is, however, different in one way. Infected people could go about their lives with mild or even no symptoms at all, helping it reach even more people than any of those diseases ever could. It creates, in effect, a society full of typhoid virus, or perhaps more fittingly for our time, coronavirus carriers. What scientists doesn't know, though, is how many of these cases are out there. At this point, it's clear that known infections or popular hotspots can't be solely responsible for the deluge of cases pouring in by the minute. While there have been many cases wherein patients with mild or no symptoms were tested positive for the virus, those are only the ones we were able to test. People with a running nose or cough tend to not think of it's a big deal, and according to many doctors and scientists, they may be the primary reason behind the mind-bogglingly rapid spread of the virus. Number 4. Why are children so good at fighting it? It's no breaking news that the novel coronavirus strain affects everyone differently. The number of fatalities are way higher for the relatively older people, which is popularly explained by their weakened immunity. That sounds like an initiative explanation, though not if you consider that the virus is virtually ineffective on children. Compared to adult fatalities, the number of fatalities among children have been thankfully almost good. While it's definitely great news, it also inexplicable, as kids these days are hardly known for their high immunities to virus or fitness. In fact, children are usually at a disproportionately higher risk of contracting respiratory viral infection, like the common flu, and yet many more people expected to have better mechanisms to fight off the virus and have died from it than kids, and we really have no idea why. Number 3. How do patients recover? At this point, we have a fairly good idea about how the novel coronavirus kills its victims, even if many of the conditions leading up to that point are still shrouded in mystery. What we still don't completely understand, though, is how anyone recovers from it. Usually, for other diseases, patients recover by developing antibodies, which doesn't just help them fight off the current illness but also secure their body against future attacks by the same strain. That immunity may not be permanent, like in the case of influenza virus, though the body still retains some signs of having fought off the diseases. That's not the case for a surprisingly high number of recovered COVID-19 patients, and researchers are struggling to understand why. In one study done in China, most of the recovered had developed antibodies specifically meant for the SARS-CoV-2 strain, which is how we would expect it would work. 30% of the patients, however, had no signs of those or any other related antibodies, and it's unclear how their bodies recovered at all. Number 2. The invisible line of transmission. Even if the number of cases around the world is growing at an alarming rate, we can at least trace most of them to potential source of the virus. Knowing that a hospital is a hotspot can help us quarantine and isolate the area. Contact everyone who may have been in its vicinity during the pandemic and ensure that it doesn't contribute towards any more infections. Wrongingly, though, we are also seeing quite a few baffling cases from around the world without any discernible route of infection. For one, a toddler in Gujarat, India, got infected and died despite there being no known case in that entire district. And one man in California became the first American to contract the virus without coming into contact with any potential host. Number 1. How does it spread? Most countries around the world are doing their best to stem the rate of infection, including strict measures like legally enforced lockdowns and social distancing rules. All of that, however, is based on the assumption that everything we know about the virus is correct, as more and more research is showing us we know very little, and our prevention techniques will have to consistently evolve if we have any chance of fighting this. The biggest mystery of COVID-19 pandemic is that we simply have no idea how it spreads, and anyone who says they do is just hazarding a guess. While it was earlier believed that it could only spread via physical touch, now research suggests that the virus could remain afloat in the air for much longer than we previously thought and doesn't require carrier like cough droplets to spread. In a possibly related cases, an entire choir was infected with the virus despite keeping their distance from each other at all times. Again, it's our biggest guess that they got it from the air, as we are still not clear on all the ways it could spread. Subscribe and turn on notifications so you don't miss more videos of Best List and much more. Check out this playlist of my top 10 videos and I'll see you in the next video. Take care.